Good afternoon, everybody. I can see that the numbers are starting to climb up in terms of participants. So just while everybody's logging on, I'll just make a start. So I want to welcome you to the webinar today. Today we'll be covering human resources and return to work practices, as well as the biosafety officer. So my name's Justine Salida. For those of you who don't know me, I'm the People and Culture Manager at Basketball Victoria. I'll also be joined by Dean Anglin, and he's our League Manager for NBL1 at Basketball Victoria. So I'll be sort of covering the HR and return to work practices, and Dean's going to be covering the biosafety officer. Just in terms of housekeeping for today, I'm sure you're getting used to hearing this, but if you can keep yourselves on mute, and you'll be able to ask questions on the chat function, which we'll do our best to get to. If there are any that we don't get to today, we'll follow them up with the slide pack. And the other point I just want to make before we start is obviously it was fantastic news over the weekend with the government making announcements on further easing of restrictions and the return to training and competitions in the near future. An online update will be given tomorrow via Zoom. And that will be tomorrow afternoon at 12 noon, and that will focus on that area. So if you have questions on that, if I can just ask you to hold those until tomorrow, and then you'll be able to listen to that information and ask any questions that you may have at that point. So if we can go on to the next slide, please. So this is our agenda for today. These are the things that I'll be covering in terms of preparing to the workplace and what's involved there, the kind of things that you will need to look at for your consultation process with employees and volunteers, any considerations there may be if you're receiving JobKeeper payments and how you manage that in terms of changing hours and things like that. The process to follow if you do have a COVID case reported at your venue. And I've just included some helpful resources of websites where you can get tools and templates that may be of assistance. Then Dean will be joining about going over the biosafety officer role and the training that's required in that area. So if we can go on to the next slide. Thank you. Now preparing the workplace. So first of all, we need to think about what is a workplace. So for us working in sport, it's not necessarily a traditional office. It's going to include everywhere that work's carried out. So that will include your courts, canteen area, referee rooms, office spaces, bathrooms, everywhere like that. So you do need to think about anywhere that your employees or volunteers are working, that's your workplace. And every organisation has a duty of care to ensure that you've taken reasonable steps to ensure the safety of all employees, visitors and volunteers that you may have at your organisation or venue. Now through this COVID crisis and the announcements that have been made from government, they have referred to having a COVID safe plan. So there's no specific plan that you need to follow for your organisation because what they're recognising is that every workplace is different. So what they're really wanting you to do is come up with an individual plan for your workplace. A lot of them will have a lot of similarities though. And there is a COVID safe principle that you should follow, and that's on the Safe Work Australia website. So in terms of your COVID safe plan, it's really around making sure that you've taken those reasonable steps to ensure safety. So that's done in a range of ways by setting up the stadium and building, documenting any steps that you're taking, training your staff and having signage that's up. And when you think about your signage, it's not just around having signage for patrons about social distancing and things like that. It's also for your staff as well. So if you've got staff toilets or staff kitchens, putting up signage there about good hand hygiene, that's important as well. So in terms of the COVID safe plan, to give you an idea of the kind of things that we're looking at for Basketball Victoria, we've done a risk assessment, and that should be conducted on any site where work is performed. So for you, that might be a venue, and you might operate at multiple venues as well. So for instance, if you've got employees going into a school, you may conduct a risk assessment on them going into that school as well. And it doesn't have to be an onerous process, but it's just about making sure that you've considered any risks that may be there, and that you've done what you can to minimise them. Then once you've done your risk assessment, the next step would be to consult with your employees. If you do have a safety representative, then it's a good idea to involve them in that process. So they could review the risk assessment that you've done and give feedback, and also just be a good another pair of eyes to look over the documentation that you've done. It's also important to communicate with external stakeholders. So it may be that you have a venue that you share with other sports, and you may have other people coming in and out of your venue. It may be a council building, or it could be a school, as I've mentioned previously. So they may want to know what you're doing in terms of making sure that you are safe inside the venue. And you may also need to know what they're providing in terms of the safe protocols. Then the next step would be to prepare the office building. So that's actually going into the building and looking at your social distancing and so on. With all this information, it's important to document it. And then once you've got that sort of physical safety arrangement in place, the next step may be to look at the mental health and wellbeing of your staff. So we also have a webinar coming up in the next week that will touch on that as well. So I suggest that that's another one to watch in the next week. Once you've got this information documented, the next step will be to train managers on any safe work practices and any changes that you've made to conditions and policies. And again, to continue to review this information. So once you've written your COVID safe plan, it doesn't just sit on the shelf. It's important that you continue to review it and make sure that any changes that you've implemented, that they are being carried out. So in terms of setting up your workplaces and looking at social distancing, we've actually gone into the Basketball Victoria office. We've looked at our placement of desks and made sure that they're at least 1.5 metres apart. And what we found was about 80% of them were already compliant in that fact. So you may find that it seems a bit worrying, but actually when you get in there and measure it out, that they're already set up in the right way. And you may only need to make minimal changes to move the desks slightly if they're a little bit close together. If they are really too close together to have people sitting together at the one time, you may consider running it in teams. So for instance, on certain days of the week, one person will be sitting at the desk, and then on the other days of the week, the other person will be sitting on their desk, which is obviously too close for them to sit next to at the same time. The other thing that we've done is measure our meeting rooms, and a sign will be put on the front door of those to show the maximum capacity of people in those meeting rooms. I would suggest that you take away extra chairs where you can if they are placed too close together, so that people don't just forget and sit too close together. If you don't have that storage room to put away chairs in that way though, another way of doing that is to just put a sign on the chair that, you know, the seat's unavailable, or some way to identify that they shouldn't sit there. Another thing to do for preparing a return to the office is arrange to have a sign-in book for staff or contractors or visitors. I would avoid having external visitors come to an office area or a workplace. And it may be that you can arrange contactless delivery for a lot of your deliveries and things like that. If you are having meetings with your staff, try and have them via phone or Zoom, and in the open air where possible. So even if you do have a meeting room that can have people present, wherever possible, try to avoid doing that at the moment, just because it's better not to be in a small enclosed space for an extended period of time. You can purchase floor decals where you can set up so that people are aware where to stand. This is especially important where you've got members of the public interacting with your employees or volunteers. For instance, if you run a canteen, you would notice in a lot of the shops at the moment, they've got floor decals on the floor to show, 1.5 meters from the counter, and spots on the floor where people can line up. And that's also there to keep not only the public safe, but also your staff as well. Another thing is setting up perspex screens as well, encouraging cashless payments wherever you can, marking walkways with signage. So you can either have arrows on the floor if you want people to walk in a certain direction, or you may educate staff or patrons to walk on the left, for instance. And as I said before, having signage around the building, that's there to educate patrons, but also for staff as well. So reminding people around social distancing, hand hygiene, cough etiquette, and things like that. So if we can go on to the next slide. So this is around consultation and communication, and you've probably heard the word consultation a lot lately, around making changes at work and workplaces. So it is a word that's used a lot at the moment, and it is really important because as changes come in, people might be feeling a little bit unsure and have a lot of questions. So by consulting, you're hearing them out, answering any questions they have, and taking into account any concerns that they have. I would encourage you to share your plans with employees and volunteers so that they can stay up to date with what you're doing and what your COVID safe plan is. Don't assume that everyone stays up to date with the news and information about COVID. So you may need to, don't assume that they have the same level of knowledge in the area as what you have. And the other thing is to not just send out documentation, so write long emails and send them out and expect everyone to read it. It's important that you talk it through with them, and also have a training session. So before you open, it might be a good idea to have a walkthrough so that everyone knows where your supplies are, what to do. Patrons, as they enter, will be also adjusting to changes, and they may have questions. So you can't be everywhere, and by training your staff, they should be confident in handling most queries on the day. In terms of cleaning, it may seem really obvious, but emphasise cleaning methods and what's expected in terms of being able to disinfect surfaces. There are cleaning checklists that you can use as a basis from Safe Work Australia. And another thing to do, sometimes people feel that safety equipment and things like that, it's not the coolest thing, which, we can understand to a certain extent, but having a biosafety officer is really important to our sport and the return of our sport. So if you can emphasise the fact that if you have a vest available to them and you want to identify that person as the COVID safe biosafety officer, emphasise the importance on wearing that vest. So they can't just have it tucked into the back of their pants, for instance. You want them easily identified as that biosafety officer. Okay, and in terms of cleanliness, people will be paying more attention to how clean your venue is. If they notice a staff member's cleaning a table in the canteen and they're just giving it a quick wipe over, that's when you're going to have people raising concerns. So again, it comes down to that training and having that emphasis on those areas. Now, when you're returning to the workplace, you may have a couple of employees that raise some concerns about returning to work, and we do understand that there is still a health crisis at the moment, and that some people may be concerned to others, and people in the public space, they do have varying levels of concern in this area. So just be understanding that people will have some questions. Some people won't worry at all. Other people will ask you a lot of questions, and also not everyone has the same element of risk factors. So if you've got older employees, or you may have someone that has an underlying health condition, they may want to discuss that with you. So just be understanding and sensitive in that area, and also respect that person's privacy. So if they give you some confidential information about their health, just make sure that that does remain confidential. If they do have any questions and they want to know a bit more information about what steps you've taken to ensure that it's a safe workplace, be prepared to go through that with them. And if you do have any queries that you're unsure of, if you've already tried to discuss it with the employee and you haven't been able to reach an agreement, I am available if you want to contact me and just ask any questions around that, and I'll be happy to help. The other thing to do is to remind staff about hand washing, sanitising their hands, coughing into elbows and things like that. And if you do notice an employee not following this, just politely remind them. And if a staff member presents to work unwell, make sure that they're sent home. And if they develop cold and flu symptoms, encourage them to be tested. So be prepared that you may have some increase in the number of people calling in sick. And this is unfortunately, we have to be accepting of that, and just reassure them that they are doing the right thing. So in the past, we may have had people come into work when they've had a cold, and it's really important that they don't do that in the future, because we really want to avoid any outbreaks in our venues wherever possible. So make sure that the process for reporting absence is very clear. So if you've got full-time or part-time employees, they are able to access sick leave if they have entitlements available, and you can ask them for medical certificates. Casuals aren't entitled to sick leave. However, during this period, they may be getting JobKeeper payments regardless. So that is just something that's a little bit different at the moment. And I will be touching on JobKeeper a little bit later. Another point to make sure is that you have contact details for all staff members and emergency contacts. So if you do need to let them know if there has been an issue, or if they haven't attended work and you need to know why, you need to have those contact details available. So document any meetings that you have and any training that's taken place. And the other thing is also take a note of attendance at work. In terms of the COVID Safe Plan and looking at a risk assessment, there's the template available on Safe Work Australia, and that's what I would use as a basis. Just to give you a brief idea, in terms of carrying out a risk assessment, you need to look at what controls are currently in place. So initially, you may have already been cleaning and disinfecting areas, putting posters up about hand washing. Now it's about looking at what further controls are required. So this would include your physical distancing, installing plexiglass screen, for instance, providing hand sanitizer and contactless delivery. So that there's just a few examples that you would put in your risk assessment about the steps that you're taking to minimise those risks. So yes, now if we can go on to the next slide. Thank you. And I just want to touch on JobKeeper, because this is quite different at the moment. JobKeeper is something that we haven't had previously, and I think that it's been a really welcome program to keep our sport going at the moment. What you may have had is when a venue closed, you may have sent staff home and they may have been receiving JobKeeper and not working at the moment on a JobKeeper enabled stand down direction, or you may have reduced their hours or asked them to do different duties. So now you need to think about what staff that you have and what your needs will be going forward. So it may be, if you've got casual employees, that they come back to work. Now, if they're on JobKeeper, they would be regular and systematic casuals. So that means that they've worked regular hours for you in the past. I have had one or two queries where associations have said, you know, what if employees don't want to come back? I think what you'll find is that most employees do want to come back. From what I've heard, most people aren't expecting to just stay at home and get paid for the JobKeeper amount. So I think proceed with this in a positive mindset that you'll have your employees quite excited to come back to work. In terms of working out their hours, it may be going forward that you need some more resources, for instance, to help with cleaning after games and things like that. So you might need to change the hours of work slightly, or for casuals that have them working longer hours. And you can do that, but you need to consult with them. So talk to them about what hours you need them to work, if there are any changes to their duties, and if there's, in terms of, they may be taking over the biosafety officer role, so they'll need to make sure that they're trained in that, and I'll let Dean talk more about that in a minute. Also, as I've touched on, in terms of cleaning, make sure that they're actually aware of what they're required to do there. And another one might be directing traffic in and out of the venue as well. So just make sure any additional duties or changes to their duties are reasonable to their skill level. And if they do bring up any concerns, that you listen to any questions or concerns they have. Okay, so another point to mention with casuals and working out how many hours to bring them in with JobKeeper, just take into account if they have any school commitments, if they're high school students or university students, and also if they have any caring commitments with children, for instance. When changing people's hours or their duties, I would suggest having a phone call with them first, and then following it up with an email. So for instance, if you've had a full-time employee who was working 30 hours a week and you'd like to bring them back full-time, just speak to them and email them the details of the hours of work and when they'll increase their hours and change in duties. So you've had that phone call and been more personable, but then you've also got a record of it in writing. When making any of these changes, just make sure that you've given reasonable notice so that they can make personal arrangements. Okay, and so that's what I wanted to cover on that slide. Thanks, Matt. So I'm not going to talk a long time to this slide. I just wanted to put this up there. This is from Safe Work Australia, and it's just a quick infographic about the process if there is a reported COVID case. So I'd just like to emphasise that you're not expected and you shouldn't try to diagnose people. So we're certainly not doctors. But if you have a suspected case of COVID at your venue, or someone's been at the venue and called you to notify you of that, this includes the national hotline number, which is there, and you'll be provided this slide deck after the webinar. So I would leave it to the experts in this case. Give them a call and they will give you steps to follow, and just make sure you've done that. And in terms of being prepared, if you've followed the steps that I've listed above in having a COVID safe plan, having trained your staff, physical distancing, signage up, etc., and the right processes in place, then you've done all that you can to meet your obligations. And then once you've informed them, they will tell you what to do. It'll involve a process of identifying close contacts and people that have been to the venue, going through a cleaning process, and then going back to review any of the COVID plans that you had in place and risk assessments, just to make sure that they are up to the right standard. So as I said, the main thing is to call that hotline and they'll really take you through step by step. And if we can go to the next slide. I've just included in here some helpful resources. And so that's including Safe Work Australia, and they're the main contact for all of the resources with templates and things like that. Fair Work Ombudsman has information with legislation, JobKeeper information, and the Department of Health and Human Services and Business Victoria. So have a look at those. They might be of help to you. And now what I might do is just see if there are any questions. So we could actually go to the next slide. Matt, that's just my questions one. Okay, so I can see here that Sally's asked for an example of a COVID-safe plan. Yes, I think we could provide an example of what you might include in that, so that's fine. Okay. And yeah, look, I think the rest of them are basically covered or will be covered after this. So now what I might do, if anyone has any other questions as they come up, feel free to put them in the chat. Otherwise, I'll hand over to Dean now. So thanks, Dean.
Thanks, Justine. Afternoon, everybody. Just see there's a couple of other questions coming through. Oh, that's just okay. That's Matt just responding. That's good. So I'm just going to touch on the biosafety officer role and the duties that are required for the biosafety officer, and then any training that we think they need to undertake. Matt, if you can just go to the first slide, that'd be great. I really want to emphasize that the primary role of the biosafety officer is essentially to monitor and record the number of people within venues. So I guess the reality for us is we don't want people to overthink the biosafety officer role, and we don't really need a policeman within venues. We really need somebody that is monitoring and recording the activity that is happening within the venue, so that at any point where we do suffer an outbreak within the venue, we've got some data and we've got some detail to be able to go back to be able to work out what sort of number of people they may have come in contact with. It is very much a recording and monitoring position, and as it says there, we want to make sure that the BSO is clearly identifiable. So a high-vis vest, something that indicates to them, to everybody in the venue, that person is responsible for the safety of the venue and has the ability to be able to tap them on the shoulder and speak to them in that capacity. Just go to the next slide. So who can be a biosafety officer? Well, it's really quite simple. It can either be a paid role or a voluntary role. We know from our conversations with the varying associations around Victoria that everybody is looking at this in a slightly different manner, and it will be determined by the size of your association and also your workforce. So there are some associations in Metro Melbourne that are looking at repurposing some of their existing full-time staff into this role. And then there are other smaller associations that are run 100% voluntary that have nominated a committee member or somebody along those lines to perform the role. That is perfectly fine as long as they're an adult and they have reasonable people skills and they have the ability to count. They should be fine to execute the duties of the biosafety officer role. In small venues, the BSO might just simply be the doorkeeper. Remembering the primary purpose of it is to monitor the number of people in the venue at any one time. So if it's the doorkeeper and they get to the relevant number based on the level of restrictions we're at the time, then they can just stop people coming through the door. In a larger venue, it may be that we need to have somebody specific and independent to the role, or it might be some additional duties for the court supervisor, noting that what might actually have to happen is they might have to go and ask some people to move on and leave the venue so that we can allow the next group of people to come in. It's not recommended that the person that is the BSO is also a coach that is active at the time. So whether that's training or during a game, what we need is for the biosafety officer to be able to prioritise the role of biosafety officer. And if they're coaching at the time, they can't prioritise one over the other because their duty of care is to the players that they're looking after. Next. I'll get to the question in a second, Kylie. So I've broken down the duties into 4 key areas: monitor, checklist, sanitize, and report. They're the 4 key areas of what we're doing. So from a monitoring point of view, we are stipulating that the biosafety officer shouldn't look after any more than 4 courts at a time. And I would suggest the extension to that is if you have a 3-court wing and then you have a separate single court, you probably are looking for you're probably looking for for 2 different people. I don't think we really want somebody working in this role that can't see what's happening on a particular court. So if you've got different blocks, you probably need to have different people looking after those areas. From a monitoring point of view, they're to record the number of people in attendance at a game or training, and that is really quite simple, of counting the number of people that they can see and writing it onto the checklist to be submitted at the end of their shift. They may have to, at some point, ask patrons to separate or leave the venue, as I said earlier, so that we can keep the numbers at the right level, and we can make sure that the next game can get in and get started at the right time. Checklists are pretty simple, and there's 2 parts to it. So one is the pre-training or game component of the checklist. We've designed them so that they essentially are a back-to-back piece of paper. So the front page is the prior to or the pre-training a game, and then the back of it is game slot specific. And the way that they've been designed, they essentially have court 1, 2, 3, and 4 side by side, and you just fill them out for every time slot that happens. From a sanitizing point of view, essentially we're asking people to sanitize equipment in accordance with the return to sport guidelines, which basically says before or after every use, score benches, game controllers, laptops, tablets, the actual benches, where hard surfaces where people can potentially leave droplets of the COVID virus need to be wiped down so that we can move on to the next group and do it in as safer manner as we possibly can. And then the final part is the reporting. So not only reporting any incidents that happen or issues, maybe they need to be reported to a competition manager or to the committee for somebody to deal with an incident. But the other one is to maintain records for 21 days. Now we've chosen 21 purely as a number. You would all hear and will have all heard that the COVID virus is asymptomatic for 14 days. We're essentially saying if we maintain the records for 21 days, that we should be able to go back and contact trace if an outbreak or a positive test happens to one of our members. It's inevitable that at some point somebody's going to test positive in the sport of basketball, and we've got to be able to do everything that we can to minimise the risk possible, and therefore having records of patrons that are in the venue is only going to help in our efforts. Next. So from a training point of view, we think that there is very much just one thing that people need to do. The infection control training course offered by the Australian government is an outstanding course that covers every level of detail around the control of the COVID virus. It takes, depending on your level of knowledge of the current COVID situation, it will take you somewhere between 15 and maybe 40 minutes to complete if you want to go and watch every video, read through every document that is available, and click on every link. It's a simple training course, but something that we probably suggest that all staff should do, including your biosafety officers. I know from a Basketball Victoria point of view, Justine has asked every employee to complete this course and supply back the certificate that you can see on the right-hand side, so that every one of our staff has an understanding of what we can do and the efforts that we can make to minimise the risk of transmission. And then the last slide, from my point of view, is just communication. This is a new role. It's a role we haven't had before, and it's going to be a role that evolves over the coming months, so that we as we all feel our way around how the new world actually starts to look. So I would suggest, especially in the early part of getting back to sport, that communicating regularly on a daily basis, with your BSOs, to make sure that they have everything they need to perform the duties, that they understand what's going on, and we're mitigating any challenges or risks as fast as we possibly can is a great thing. If you have multiple people performing the duties, and I think I saw a comment come through regarding multiple venues. If you have multiple people, then maybe having a Facebook Messenger group or a Slack channel for them to be able to chat in real time around issues that are happening in the venue would be beneficial, but it'll also mean that the person that is working Monday night versus the person Tuesday night will be able to understand what the challenges are that are being faced. It's as I said, it's going to be an evolving thing. We don't know everything about how this role is going to play out, so we need to feel our way through it a little bit. Rightio. As I said right at the start, I don't want people to overthink the role because it's very much a monitoring role. It's not a role that is going to be one that needs a lot of training to perform. Okay. Let's go to some questions because they've been firing through thick and fast. I've just got to find the right starting point. Apologies. Do we need a biosafety officer for training venues? Yes, absolutely. So we need to make sure that in every component of every time that a venue is active and we have patrons within the venue, that we have a nominated biosafety officer that is working for that day and recording the details or data of people that are in the venue. What's our best guess on how long biosafety officers will be needed for? Don't know. I mean, to be honest, we probably find things out almost at the same time that you find them out. Sunday at 10:30 in the morning, we were astounded at some of the stuff that we were hearing. But so, how long are we going to need a biosafety officer for? Probably we're aiming to roll into Orange 50 as our strategy. I would think by the time we get to Green 100 in terms of our strategies, a biosafety officer may not be required. Should coaches do the course? Absolutely. Yep. Coaches, team managers, score bench officials, anybody that has the ability to potentially transmit the virus, you should be asking to complete the course. Maddie, you're just making some comments around Play HQ. So yeah, I mean, look, I keep saying to people as we have conversations with government that we are, as a sport, we are far more advanced in the data collection and detail collection of our participants than most other sports. The history of either Play HQ, or stadium scoring means that we do collect the data for every player and participant that's happening in a game. It may just mean that one thing you want to do is increase the component to registering and recording your coaches' names and team managers' names within the system as well. That might not be something that everyone does at the moment. Do we need to keep the names of attendees for training sessions? It's an interesting one, Kylie. I would think that if we know the team that is training, then we should know the attendees, if that makes sense. So as long as we know that from 10 a.m. till 11 a.m. it was the under 14 fours that were training on court 4, then we should know all of the attendees in the under 14 fours that would be at that training session. It is more about making sure that we know the number of people that were there so that we can then make sure that there isn't any data that is missed. If you have a crossover of teams, then you probably need to make a record of attendance. Do you need to provide BSOs for external court hire groups? Yes. To be honest, yes. Every time your venue is active, you need to have a biosafety officer monitoring who's in the venue. And if you've got external people coming into your venue, then you should be taking a list of all attendees because they're not people that are going to be recorded in your standard systems. And how do you manage venues that are not directly responsible, i.e. independent teams and local court hire? That's exactly the same thing. Schools are a bit different. Schools have their own protocols for managing coronavirus. But if you have independent groups coming into your venue, then you need to make sure that you take record of every attendee that comes into your venue and note the time that they came in and the time that they departed. I think that's it from me. Justine, got any more?
Sorry, I was just on mute. I don't really have any more at the moment, and I'm just looking at the questions. I don't think any further questions have come through. The only point I'll make is that, yes, if you need some help with some of those templates, for instance, a risk assessment or a COVID safe plan, we can help with an example of that and arrange for that to be sent out. And again, I'll just say if you have any questions relating to your association and bringing staff back and what you can and can't do, I am here as a resource. If you want to give me an email, send me an email and I'll provide my contact details. Thank you.
Cindy, just to answer the last question that came through. Yes, there is a position description written for the biosafety officer. And as with all of the documents that will be available for Orange 50, the move to Orange 50, they'll be available after tomorrow's webinar. Wonderful. I think we may have reached the end. As Justine just said, if you've got any other questions, feel free to shoot them through either to Justine or myself. Otherwise, thanks for joining us for the last hour. Hopefully you've got something out of it from a HR point of view and or from a preparation of your biosafety officer role. We are excited that we're finally talking about a resumption of the sport. So I hope everyone's as excited as we are that we might start to hear that annoying sound of balls bouncing on timber again very, very soon. And we look forward to seeing you all tomorrow when we add a little bit more detail to it. Thanks, everybody.
Thanks, everyone. See you tomorrow.